This video will discuss the application of the lace-up ankle support in the posterior tibial tendon dysfunction brace, also known as the PTTD brace. First and foremost, ankle support, they come in small, medium, large, those types of sizes. You get more acclimated to what's more appropriate for the patient, but I always bring a few in the room, so if you feel like it's not comfortable for the patient, you can switch it out real quick. You're going to have to loosen the laces first, and you're going to slide this on the foot. Okay, and once you've done that, there's this little inner sleeve kind of tongue underneath, and make sure that's nice and flat, and you're going to tighten it just like a traditional shoe or ankle support. Go all the way to the top here. And again, you want it snug but not so tight that it's causing discomfort, and make sure the tongue's underneath the portion where you tie, otherwise that will cause discomfort as well. And once you've tied the laces, make sure they're put at about 90 degrees and try to have them hold that for you. What you're going to do first is you're going to put these straps around the ankle, and there's two of them. And you would definitely want to ask the patient where their pain is. So if the patient says they have pain on the outside of their ankle, you want to put the last strap you put on when you be the one that finishes in the outside. So in this case, this one goes around just like this, around the bottom of the foot, finishes on the inside, and there's a Velcro strap there, okay? And because we want to support the outside of the ankle, again, we're always going to finish with the one that's on the side of the pain. So if it was the middle of the ankle, it would be just the opposite. But since we want to make sure the patient's foot is 90 degrees, and we can turn it slightly outwards to give that side of the ankle a little more support, and then Velcro the strap on the side. The final way to finish this is a little Velcro strap on the ankle that holds it nice and snug and holds your laces down. And this patient is fitting her very nicely. It's finishing right in her arch. And that's how you apply that lace-up ankle support. So we'll quickly take this one off. And it actually Velcros very nicely. It's easy to get off. For patients that have pain along the instep of their ankle, you can technically use this brace. There is another one called the posterior tibial tendon dysfunction brace. And that one's going to have a special strap and actually an air bladder in it to help support the arch, because that tends to be painful in the patients that have that condition. And this one's a little stubborn. Here we go. So here's the posterior tibial tendon brace, slightly different, same kind of concept. You slide this over the foot. Oh, no, we're not going to slide over that foot. It's the left one. These do come in left and right. That's the difference without the lace-up ankle support. Lace-up ankle support is for either side. So now we have the correct foot. I'm going to slide that over. It's too small for you. Alright, this is a perfect example. If it's the wrong size, obviously you need to go to the next size up. Of course, this one's a right. Keep moving things around here. There we go, that's the right size for her. So you're going to slide that on. The first thing you're going to do, there's a strap in the back of the ankle while they're holding their foot at 90 degrees. You're going to take this little strap and you're going to Velcro it on the side here. And once that's done, then there's a strap here on the side that when you pull this, it actually helps hold up the arch and protect that tendon. So you're going to pull on that, make sure the foot's at 90 degrees, finish around the ankle, and Velcro it just like so. And then in that actual kit, you can have the patient step in their put their shoe on, step down on the floor. There's just a little bladder that blows air out of one side and sucks air out of the other. You want to put air into the bladder of the actual device until the patient starts to feel it, and then once they feel it, just give it a couple more pumps, and that way it supports the arch and gives that tendon that they're having soreness a little bit of a break. And that is the posterior tibial tendon dysfunction brace and the lace-up ankle support.